Good morning, David.
Good morning, Dr. Russell.
Thank you for coming in today. Okay, so we have your lab work back. And what we found out, we had run what's called an A1C, which is, it tests your blood for sugar or glucose over a 3-month period. According to the American Diabetes Association, the normal range is below 5.7. The pre-diabetic range is 5.7 to 6.4, and the diabetic range is 6.4 and up. Your number was 7.2. So therefore, you do have type 2 diabetes. Type 2 diabetes is different than type 1, and that type 1 diabetes, the person's pancreas does not produce the insulin needed to control their sugar. And type 2 diabetes, your body does produce the insulin, however, it doesn't utilize the insulin to reduce the sugar in your blood. So that's what you have. There are some risk factors for getting type 2 diabetes. Those are being over 45, being a little bit overweight, having a sedentary lifestyle, having family members, first-line family members that also have diabetes. So those are some of the risk factors that can bring you to a type 2 diabetes diagnosis. Type 2 diabetes is progressive. This isn't something that just happened overnight. This has been steadily going on, and it has just now crossed over into the diabetic range. However, we didn't know that beforehand because you're a new patient here. It is a progressive disease, however. Type 2 diabetes is not necessarily cured, however, it can be managed. And that's what I want to talk to you about today, is how to manage your disease. Does that sound like a good idea?
Sure.
Great. Okay, so the first thing I want to talk about is a sedentary lifestyle. I understand that you have a desk job and that you don't get a lot of exercise based on your desk job. So one of the things I want you to do is I would like for you to start doing some exercise 5 days a week. It doesn't have to run a marathon. It doesn't have to be anything major. It can be as simple as walking 30 minutes a day, 5 days a week. Okay? Okay, the second thing I want you to do is we are going to set you up an appointment with our diabetes education specialist before you leave the office today. And what she's going to do is she's going to talk to you about how different foods and how sugar really affects your sugar levels and what you can do with your diet to maintain a healthy sugar level. Some of the things that I'm going to recommend for you before you leave today are some of the simple ones, and those are things like no sugary pops, no fruit juices. Fruit juices are full of sugar. Try to stay away from white flour. That could be white bread, hamburger buns, donuts, things of that nature, bagels. All of those things can increase your sugar. But again, I'm going to set you up with that appointment with the education specialist. And the third thing we're going to do is we are going to write your prescription for a first-line drug therapy for type 2 diabetes, which is called metformin. And what I want you to do is I want you to take it twice a day. I want you to take 1 pill in the morning and 1 pill in the evening. And we're going to do that for 2 weeks. At the end of 2 weeks, then I want you to increase your dose to 2 pills in the morning and 2 pills in the evening. And the reason we're going to do that is because metformin can cause stomach upset in some people. And if you find that that's happening and your body's not adjusting over that time frame, then feel free to call the office and we'll see, we'll try to find a different medicine for you. But generally the body will eventually be okay with the medicine, okay? So those are the 3 things that we are going to try to address. Again, it can't be cured, but it can be managed. And these are the first steps that we're going to take to try to manage it. Do you have any questions for me? We're also going to have you come back in 3 months. Okay, we'll have you come back in 3 months so we can recheck your A1C and see if we're getting those numbers down at all. They're not going to come down overnight, but we can really work hard at it.
All right.
Do you have any questions for me?
No.
No? Okay, so then I guess what I want to do then is I just want to make sure that you have a full understanding of the information that I just gave to you, because I know I gave you a lot. So I'm asking if you can maybe repeat back to me your diagnosis and the 3 steps that I gave you to try to manage this. Can you do that for me, please?
Sure. My A1C was too high. It was 7.2. It should be much lower than that. It means I have step 2 diabetes.
Type 2 diabetes.
Type 2 diabetes. And I need just maybe start exercising at least 30 minutes a day for 5 days a week.
Yeah.
Maybe some walking, jogging, possibly if I lose some weight. And, try to bring my weight down, bring my sugar down, and just get more active. Also, go to some some dietary education to learn what not to eat and the things that I can eat that will help bring my sugar down, and also start taking some metformin 2 times a day for 2 weeks, and then 4 times a day. Or
Nope.
2 in the morning and 2 at night after 2 weeks.
Yeah, and so in
See
the
how
beginning,
that
you're going to do 1 in the morning and 1 at night.
Yes.
Yep, and then we're going to have a follow-up visit.
In 3 months.
And then 3 months, we'll recheck your A1C and we'll see if we're bringing it down at all.
Okay.
Okay, do you have
Yeah.
any other questions for me today? Okay, thank you for coming in.
You're welcome. Thank you for seeing me, man.